This further, joining us to discuss, Lanhee Chen, former policy director for Mitt Romney's 2012 presidential campaign and former advisor to Marco Rubio's 2016 presidential campaign. Also with us, Chip Roy, the former chief of staff for Senator Ted Cruz, one of the no votes currently. Chip is now the director of the Center for the 10th Amendment Action at the Texas Public Policy Foundation. Lanhee, let me start with you. Which side do you think is going to have to give in if this bill is going to get passed, conservatives or moderates?
I think that's a really tough question to answer, Anna, because you've actually got some problems from both sides. You've got some conservatives who are expressing a point of view that maybe this bill mirrors elements of Obamacare too much. And then you've also got some moderates who are uncomfortable with what's happening with Medicaid. The reality is that this piece of legislation is about as delicate of a balance as you're going to find between the two sides. And for that reason, it's going to be very difficult to move in one direction or the other without upsetting one side or the other.
Chip, do you agree? We know that in the House it was the Freedom Caucus who eventually got a few more things thrown in to get the House bill passed. Do you think Ted Cruz and those who support his reasoning to not vote right now for supporting the bill, do you think he's going to get what he wants?
Well, first, thanks to the Freedom Caucus for at least getting some waivers in the bill so that states have some flexibility. We wouldn't even be talking about that if the Freedom Caucus hadn't put up a bit of a fight back in April. But I find it interesting that the so-called greatest deliberative body in the world, the U.S. Senate, introduces a bill, the text of which we see late last week, and now the leaders are saying they're going to vote on it by the end of this week. And I think that's why a lot of the American people are raising questions, and that's why there are a number of senators, kind of at all ends of the spectrum, but obviously particularly some conservatives who are raising concerns because they don't believe that the bill does nearly enough to lower costs, lower premiums. And I think the issue that you've just raised gives away the entire game. I mean, the fact that they are now adding in a provision to force there to be a penalty for not having coverage really underscores the fact that if you don't free up the market with the pre-existing conditions requirement, it doesn't work. The math just simply doesn't add up. So they recognize that.
Do you think that insurers should not have to cover people with pre-existing conditions?
Well, it does. Insurance doesn't work if there's a forced requirement to have coverage for pre-existing conditions. Now, I say that, as I think I've noted to you before, as somebody who's a cancer survivor and understands very much what a pre-existing condition looks like. But you can't have an insurance market function if you're going to force the market to take people in after they're sick. You can fix that through high-risk pools. You can fix that through better Medicaid provisions. And there are a lot of things we can do.
But high-risk pools was exactly the problem before Obamacare came around. People with pre-existing conditions weren't getting the coverage they needed to be able to afford health care.
Well, I think the biggest problem... Go ahead, Lanhee.
I was just going to say, you know, on high-risk pools, Anna, I think the big challenge has always been, frankly, they haven't been properly funded. I think one of the things that both the House and the Senate bill try to do is to create a mechanism to help to cover people who do have these pre-existing conditions through moving it toward a more market-based mechanism. To Chip's point, I think this regulatory reform is absolutely crucial. The Senate bill actually does include, in my mind, a very important provision that would give states greater flexibility around designing their own health care programs. That's one of the reasons why I do think the Senate bill is the right step forward, even though there are a lot of things in there. I think as conservatives, we'd love to see more regulatory reform, but the reality is this is what we have in front of us right now. If we want to turn back Obamacare, this is the vehicle we have to use.
Guys, let's take a look at the latest poll on Obamacare real fast, and then I'll let you respond, Chip. I'll just throw this up there, though. You know, Obamacare and the GOP replacement plan were recently polled, and this is the first poll of 79 that the Kaiser Family Foundation has done since 2010 that shows a majority approve of Obamacare or see it favorably. Its popularity continues to rise while the GOP plan is hovering right now about 30% support. So why would Republicans vote on a bill that is widely unpopular, Chip?
Well, I think it's inexplicable why they're pushing a bill that's polling. I mean, I've seen polls below 20%. But I think to Lanhee's point, I mean, we agree that some of the greater flexibility is a good thing. But the problem is a lot of that is on the essential health benefits. It doesn't get to the root problem that involves the community rating the pre-existing conditions. The high-risk pools weren't working before because they weren't, as Lanhee pointed out, structured properly. But if you set them up the right way, you can have a market that works. And look, we're talking about 330 million odd Americans. 170 million are covered by employer-provided care, 60 million by Medicaid, millions more on Medicare. We've got the group of Americans who need coverage, and we've got maybe 2 to 4 million that are in that pre-existing condition camp. We're the greatest country on the face of the earth. We can solve that problem for them without turning the entire health care market on its head, and I think that's where Republicans are getting this wrong and not providing market-based solutions.
Chip Roy, Lonnie Chen, our thanks to both of you. The White House press briefing, by the way, just